Hello everyone, in this video we will see ICD-10-CM guideline questions. First question. A coder selects diagnosis code directly from tabular list without verifying its alphabetical index. What is the correct guideline? Option A. This is acceptable if code is complete. Option B. Alphabetic index must be used first, then tabular list. Option C. Only tabular list is required. Option D. Either can be used frequently. So the answer will be option B. Alphabetical index must be used first, then tabular list. According to the coding guidelines, according to the ICD general coding guidelines, always we have to use alphabetical index first and then tabular list. Guys, you can see here in the guideline, locating a code in ICD-10-CM, first locate the term in the alphabetical index and then verify the code in tabular list. So this is the correct guideline. Always we should follow. Second question. A patient has confirmed pneumonia with cough and fever. How should the symptoms be coded? In this question, they are saying a patient is visited to the hospital with cough and fever and he has confirmed pneumonia. How the symptoms be coded? So, the option A is always code symptoms separately, never code symptoms, do not code symptoms routinely when the diagnosis is confirmed, code only fever. The answer will be option C. Do not code symptoms routinely when diagnosis is confirmed. So guys, according to the ICD conventions, you can see here code the described symptoms and signs as opposite to diagnosis are acceptable for reporting purpose when a definitive diagnosis has not been established or confirmed by the provider. So in this convention, they are saying that if the definitive diagnosis is not confirmed by the doctor, in that case we should code signs and symptoms. If the diagnosis is confirmed, we should not code signs and symptoms. We should always code diagnosis. So the answer will be C. Third question. Which statement correctly differentiate the coding of signs and symptoms from confirmed diagnosis? Option A. Both are always coded together. Option B. Signs or symptoms are coded only when no definitive diagnosis is established. Option C. Diagnosis is coded only when symptoms are absent. Option D. Symptoms replace diagnosis. The answer will be option B. Signs or symptoms are coded only when no definitive diagnosis is established. So guys, you can see in the signs and symptoms guideline, when a relative definitive diagnosis is not established by the provider. So signs and symptoms are opposite to diagnosis, are acceptable for reporting purposes when a definitive diagnosis has not been established or confirmed by the provider. So when the diagnosis is not given, in that case we should always code signs and symptoms. We should not code anything, like we should not code diagnosis. We should only code signs and symptoms when the diagnosis is not given in the documentation by the provider according to the signs and symptom convention. Fourth question. A patient has bilateral otitis media, but the ICD-10-CM does not provide a bilateral code. What is correct? So they are saying a patient has bilateral otitis media. He has otitis media in both the ears. Bilateral means on the two sides. But ICD-10-CM does not provide bilateral codes in the ICD book. So there is no bilateral code in the ICD book. Then what is correct? So the option is code only left ear only. Option B, code right ear only. Option C, assign code for both right and left and right. D, use unspecified code. So the answer will be option C, assign codes for both left and right. According to the laterality convention, some ICD codes indicate laterality, specifying whether the condition occurs on the right or left or is bilateral. If no bilateral code is provided and condition is bilateral, assign separate codes for both the left and right side. If the site is not identified in the medical record, assign the code for unspecified code. So the answer is C, guys. You can see that is assign code for the both left and right. According to the coding guidelines, that is laterality convention, if no bilateral code is provided, the condition is bilateral. Assign separate codes for both left and right side. So the option C is correct. Fifth question. A coder assigns 3 characters code even though a 5 character code exists. Why this is incorrect? So in this question they are saying a coder is assigned 3 character code for the particular condition even though 5 character code exists for that condition. So this is wrong. They are asking why this is incorrect. The options are 3 character codes are invalid, it lacks specificity required by the guidelines, it changes diagnosis, it affects billing only. So the answer will be, answer is B. It lacks specificity required by the guidelines. So according to the level of detailing in coding, diagnosis codes are used and reported at the highest number of characters available and to the highest level of specificity documented in the medical record. So we should always code the maximum characters present for that condition. We should not code as per our wish. We should code as per the coding guidelines. Sixth question. External cause codes. Option A are always primary. Option B should never be used. Option C are supplementary and not primary diagnosis. Option D replace diagnosis code. The answer will be option C, that is are supplementary and not primary diagnosis. Guys, you can see here external use of external causes of morbidity code convention. An external cause of morbidity should be assigned to identify the cause of injury incurred as a result of hurricane. The use of external morbidity codes is supplemental. So you can see in the option they are supplemental to the application of ICD-10-CM codes. External causes of morbidity codes are never be used as principal diagnosis. It means primary diagnosis first listed in non-patient setting. So they are saying external causes codes are supplementary and these never be coded as first listed diagnosis. It means we should not code them as first. Seventh question. A patient is diagnosed with diabetic polyneuropathy. Using ICD-10-CM guidelines, which ICD code is correct? Option A E10.42, option B E10.9, G62.9, option C E11.9, G62.9, option B E11.42. So the answer will be option D E11.42. I'll explain why it is. So guys, you can see in the question the patient is diagnosed with diabetic polyneuropathy. They didn't mention which type of diabetes, whether it is type 1 or type 2. According to the ICD-10-CM guidelines, if the type of diabetes is not mentioned, we should use type 2 as a default. So if the type of diabetes is not mentioned, we should always take type 2 diabetes. So go to the ICD alphabetical index, search diabetes, and in the diabetes type 2 you can see here diabetes poly in the subterm polyneuropathy. Diabetes as the type of diabetes is not mentioned, we are taking type 2 diabetes, and in the subterm polyneuropathy, that is the code will be E11.42. So the answer is option D E11.42. Thank you for watching, guys. Comment down in the comment section how many of you got right. If you want more practice questions like this and more topics on medical coding for CPC exam, comment yes in comment section.